In this video, I will discuss the femur bone in detail. The word femur is derived from a Latin word os femoris, which means thigh bone. The femur bone is the longest, strongest, and the heaviest bone of the human body. The length of the femur bone is almost 26.74% of the total body height, mean almost 1/4 of the total body height. And this is an important point in forensic medicine, because if you find a femur bone and you want to know the height of that person, so through calculation you can find out the total height of that man. Now the function of the femur bone is to transmit the weight of the body from the hip bone and pass it to the tibia. Superiorly, femur bone articulate with the hip bone at the acetabulum. Now, this is the hip bone and this is the acetabulum, in which the head of the femur articulate, and this is an example of ball and socket joint. Inferiorly, the femur bone articulate with the tibia and patella bone at the knee joint. Now we came to the side determination of the femur bone. For the side determination, you only have to remember 2 points. First one is that the 2 condyles of the femur bone should be on the posterior and the head of the femur bone should be on the medial side. So this is the right femur bone. Now let's come to the bony landmarks of the femur bone. The femur bone has 2 ends and a shaft in the middle. We will begin with the proximal end. This is the head of the femur bone, and on the head there is a depression called as the fovea. This is the neck of the femur bone. This is the greater trochanter. This one is the lesser trochanter. Between the greater trochanter and the lesser trochanter, on the interior side, this line is called as the intertrochanteric line, while on the posterior side, between the greater and the lesser trochanter, this is called the intertrochanteric crust. Because it looked like a crust, that's why it is called as the intertrochanteric crust. On the intertrochanteric crust, there is a tubercle called the quadrate tubercle, and on the quadrate tubercle is inserted the quadratus femoris muscle, and it's quite simple to understand because both has quadrate in their name. Now on the head of the femur, this depression which we call the fovea of the femur bone, and to this fovea is attached a ligament called the ligamentum teres. Now here is one important point you should know. Embryologically, the head and neck of the femur are separated by a cartilage called the growth cartilage that you can see here. And because this is a cartilage, so it is avascular structure, no vessel can pass through it. So the blood supply of the head of the femur is different from the rest of the femur bone. The obturator artery give a branch called the round ligament artery, which enter the head of the femur bone at the ligamentum teres. So this artery supplies the head of the femur bone, while the rest of the femur bone are supplied by the circumflex arteries. These include the medial and the lateral circumflex arteries, which are loop around the neck of the femur bone, and they all originate from the deep femoral artery. As the person become adult, so the growth plate become fuses, and then the round ligament arteries become disappear. So after that, the head of the femur bone is also supplied by the circumflex femoral arteries. So we can say that embryologically the head and the rest of the femur bone has different supplies, but as the person become adult, then after that the head along with the femur bone are supplied by one artery, that is the deep femoral artery. Now on the posterior side of the femur bone, this is the pectineal line and this is the gluteal tuberosity. Now both of these join together to form the linea aspera. This whole line is the linea aspera and it is on the posterior side of the femur bone. The linea aspera has two lips. One is the medial lip and the other one is the lateral lip. To the pectineal line is attached the pectineus muscle, and to the gluteal tuberosity are attached the gluteus maximus muscle. And again it is quite simple to understand because both the muscle has their name that give us the clue where they insert. Anteriorly, the shaft of the femur bone is convex. Distally, the medial and the lateral lip of the linea aspera separate from each other. The medial lip form the medial supracondylar ridge, while the lateral lip form the lateral supracondylar ridge. And in between these two, a space is formed called the popliteal surface. The medial supracondylar ridge ends by forming a tubercle called the abductor tubercle. These two are called as the condyles. This one is the medial condyle and this is the lateral condyle. Above these two condyles are the epicondyles. This is the lateral epicondyle and this is the medial epicondyle. Between these two condyles, a fossa is present called as the intercondylar fossa. Now if I move to the front view, this is the patellar surface and through this it is attached to the patellar bone. Now on the interior side distally there is a groove called the trochlear groove, and this trochlear groove is a depression formed by the patellar bone. The last thing in the femur is the angle of inclination. The femoral angle of inclination is the angle formed between two imaginary lines. One of the line passes through the shaft of the femur bone, while the other one passes through the neck of the femur bone. Now the angle between these two is called the angle of inclination. The normal value of angle of inclination is in between 120 degree to 135 degrees. Thank you.